Assalamu alaikum. Hello everyone. It's Dr. Muhammad Musliuddin. Inshallah today we'll discuss about that why does the vitamin D deficiency is more common in dark skinned people than the white. Allahumma rabbi sidni ilma rabbi shrah li sadri wa yassir li amri wa hlul 'uqdatam min lisani yafqahu qawli. So all of you know that the vitamin D synthesis is started from the keratinocytes located in the epidermis of our skin. So look at the diagram. Here you can see that these are the keratinocytes. Okay, so if we draw a figure of keratinocytes, suppose this is the keratinocytes. So in the cell membrane of keratinocytes there is 7-dehydrocholesterol, which is the earliest precursor of vitamin D. So when the keratinocyte is exposed to sun ray, suppose whenever the person is in outside of the house, so the ultraviolet ray from sun, it will emits on the keratinocytes cell membrane through the refraction. Then the keratinocytes, with the help of this ultraviolet ray from the sun ray, the keratinocyte converts its 7-dehydrocholesterol into pre-vitamin D3, into pre-vitamin D3. Then this pre-vitamin D3 will isomerized into vitamin D3, into vitamin D3. Okay, so this vitamin D3 is now present within the keratinocytes. So at this moment the vitamin D3 will come outside of the keratinocytes and enters into the systemic circulation. So if we draw that figure, suppose that was the keratinocyte, and here the round shape balls, it indicates vitamin D3. Now this vitamin D3 externalized into systemic circulation. This is blood vessels. So within the blood vessels, the vitamin D3 will combine with the vitamin D binding protein. That means there are some carrier protein, which is known as D binding protein. So the D binding protein will carries the vitamin D3 through the systemic circulation, and it will transport the vitamin D3 towards the liver, So here you can see the liver, and the functional unit of liver is hepatocyte. So at this moment the green particles, which indicates the vitamin D3, has reached within the cytoplasm of hepatocyte. Now the hepatocyte will convert the vitamin D3 into calcidiol, If you look at the description, in liver, hepatocyte will convert the vitamin D3 into calcidiol. The chemical formula name is 25-hydroxy-vitamin D with the help of 25-hydroxylase enzyme. Okay. So at this moment within the hepatocyte, all of the vitamin D3 has been converted into calcidiol. Now again in the same manner, the calcidiol will enter out of the hepatocytes and reach into the systemic circulation, and they will be transported towards the kidney, especially the tubular cells of proximal convoluted tubules, through the vitamin D binding protein, again in the same manner. Okay, so now I want to say you that the calcidiol has reached into the nephron, that means the tubular cells of proximal convoluted tubules, and at this time if I draw a nephron here, you can see there is a nephron, and these are the tubular cells of proximal convoluted tubules. Now this calcidiol, if I indicate the calcidiol as blue colored round ball, So the calcidiol has reached into the cytoplasm of tubular cells of PCT. Now the tubular cells will convert these calcidiol into calcitriol with the help of 1-alpha hydroxylase enzyme. 1-alpha hydroxylase enzyme. So look at the description. In kidney, calcidiol is converted into calcitriol with the help of 1-alpha hydroxylase enzyme, and this calcitriol is the active state of vitamin D3. So what will happen there? The calcidiol, which indicated by blue shape dot, it will be converted into calcitriol, which is known as active vitamin D. So in this manner the vitamin D synthesis is completed. So we have known that from the description that the vitamin D synthesis is started from the cell membrane of keratinocyte, and the initial phase is started with the exposure of ultraviolet ray from the sun. So you know that in the basal portion of epidermis there is the melanocytes. So you can see here, these are the melanocytes. So what does melanocyte do? Melanocyte synthesize the melanin pigment, which is a protein, and excretes it towards the surrounding cells. That means the melanin pigment, it is synthesized within the melanocytes. Then it will come out from the melanocyte through exocytosis process, and it will reach into the interstitial space, that means the space between the keratinocytes, and after that all of the keratinocytes will engulf this melanin pigments within their cytoplasm. So the one important function of this melanin pigment is that it absorbs the ultraviolet ray and protects the cells from the mutation, from the formation of cancer, okay, by preventing the genetic DNA mutation. But whenever there will be excessive melanin, what is happening in the dark skin containing people, so whenever the keratinocyte gets excessive amounts of melanin, so the keratinocytes cannot take adequate amount of ultraviolet ray, which is required to convert the 7-dehydrocholesterol into pre-vitamin D3. That's why the keratinocyte cannot produce adequate amount of pre-vitamin D3. Ultimately, the whole process of active vitamin D, or that means calcitriol synthesis, is reduced. That's why the vitamin D deficiency is more prone to happen in dark skin containing people rather than the white.